Well, good morning and thank you for joining us. You've landed at the CAF Los Angeles County Emergency Preparedness Updates, and it's brought to you from the CAF Disaster Preparedness Program. What we try to do on these webinars is collect the information and updates from the DRC meetings, as well as, we're definitely going to talk about some other stuff besides what came up at the DRC meetings in the last quarter. But we'll get to that in a second. Today is August 19th, 2021. It's 10 o'clock in the morning. These updates are brought to you effective as of today. There will be a meeting tomorrow with LA County Department of Public Health, the ACDC unit. I'll show you the link and things like that. And so we know some changes are going to come and they're going to be verbalized in that webinar tomorrow. So it's definitely important that you pay attention to that webinar or have somebody from your staff attend the webinar for tomorrow. All right, let's get started with our speakers for today. If I can advance the slides here. Here we go. My name's Jason Belden. I'm the Director of Emergency Preparedness at CAF. With me today is Summer Brazell, the Disaster Preparedness Program Coordinator for CAF. And I did not have a chance to get Jennifer Calderon from LA County EMS on the call with us today. But generally, both Jennifer Calderon from EMS, Los Angeles County EMS, who is the coordinator for our program for the skilled nursing facility sector for the Los Angeles County EMS agency. Normally she would join. And we also have a consultant named Rich Wodorensky. Most of you folks, or a lot of you folks know Rich through his time at CAF. And gosh, Rich has been an active CAF member before he was a consultant for almost 30 years. So Rich has decided to retire. And so we're going to be looking for a new consultant to attend the DRC meetings based in Southern California. If you guys have someone in mind, somebody that likes to attend those meetings and would like to earn some extra income by attending the meetings and providing us reports from those meetings, we'd certainly be happy to hear from you if you're interested in doing that. So definitely reach out to me if you are. And that's kind of the arrangement we had with Rich. So, but in the meantime, what's going to happen? We're lucky enough that the DRC meetings are still continuing to be virtual due to the, well, I mean, it's not good. The reason because the surge is still there and COVID is still a thing. So they're limiting the time that we spend together when possible. And so most of the meetings are going to remain virtual for the remainder of the year. That's good news for you because it allows you to attend the meetings without actually having to physically be there if that's what you want. Just some housekeeping items. Generally on these webinars, we don't have live Q&A, but if you have questions, please enter them into the question and answer question box, and I'll get to them at the end. And if I happen to see any that come up while I'm presenting the material, I'll try to answer them as they come. All right. Today we're going to, sorry, I put the wrong date in here, or I left the wrong date from the last slide deck that I used for this, but I apologize. These are the objectives for today, which is August 19th, 2021. We're going to discuss DRC, CMS, and state updates. We'll discuss some upcoming trainings, webinars, and education. We'll review the recent guidance from LA County Department of Public Health. That's slightly different than the visitation AFL, but I just want to point out what LA County DPH has sent to me in order to operationalize the visitation requirements right now. And then, of course, they're going to have that webinar tomorrow. And then we'll discuss the vaccination requirements, both for staff in the state public health order, because I know folks have tons of questions about that. So we'll dive right into those topics. As this is a matter of background, we use a lot of acronyms in emergency preparedness, and sometimes they're hard to keep track of. These are just some of the acronyms that I may or may not mention during this webinar, but the LACDPH, that stands for Los Angeles County Department of Public Health. We'll definitely talk about those folks today, as well as possibly AAR and IPs and things like that. So, and when I say DRC, that stands for Disaster Resource Center. And we're going to show you a map of the Disaster Resource Center. So we know there's about roughly 385 SNFs, or just under 400 SNFs in Los Angeles County, and that's where you can see they are spread throughout the county. Those your skilled nursing facilities and intermediate care facilities are assigned to disaster resource centers. And that generally means that during disasters, caches of supplies and things of that nature are generally passed out by those disaster resource centers rather than the county. Since the county is so large that they need to stage kind of resources and utilize those hospital partners as being hubs during disasters. And that's both during response, but during the planning stage, which is really important, is what we talk about. Like, how do we plan, prepare, and work together, you know, so that when response time comes, we know what to do, and we've had it well planned out with our partners. So those are the disaster resource centers. In your handouts today, we have a list of DRC meeting dates, along with the contact information for each one of the DRC coordinators. So I've got the folks here on the slide, so you have it in the slide deck as well as the handout. Now, the handout itself has the dates, the proposed dates for the remainder of the year. You know, they're trying to stay consistent with those dates, but my suggestion is, if you're not, you know, you haven't attended these in the past, reach out to your DRC coordinator and just ask to be put on the listserv so that you know when the next meetings are going to be. While they're virtual, I definitely, you know, want you guys to take advantage of that ability to not have to drive over to the hospital to attend the meeting. All right, in the handouts, we've, well, I'll go over, you know, kind of the guidance documents that really are just within the last few weeks, you know, are super important for you to understand, because they have operational requirements that you have to have in place right now. And so that first link is a link to the Los Angeles County Department of Public Health ACDC manual for skilled nursing facilities. So it has the updated guidance. Now, the last time they updated it was on July 27th. And we know that's going to again be updated because that was updated prior to the state public health order for both the requirement to have visitors be vaccinated or test. I'm going to talk in depth about, you know, kind of what that is in LA County right now. We'll get to that in a second, but there's a link to the website that has all the changes. So when they change it, that's the section they make it in. It has, you know, general guidance on visitation, communal dining, group activities, testing, PPE. All that is contained within that one page there. The second link you see highlighted there is the vaccine requirement, or the state public health order for all healthcare workers. That applies broadly across all healthcare spaces, and we'll talk about that in a second. That third link, the vaccine and testing for visitors to healthcare facilities, is a link to the state public health order that requires visitors to acute hospitals, skilled nursing facilities, and intermediate care facilities to either be vaccinated or tested for certain types of visits. And we'll go over those requirements and where they apply, and what are the workarounds and exceptions to those to that rule. We'll talk, and the handouts that I included today are the DRC meeting schedule and contact list for the DRC folks, as well as redlined versions of the last 3 AFLs that came out that are in relationship to the state public health orders. So AFL 2029 is visits and communal and group activities in skilled nursing facilities. 21-14.1 is the same for intermediate care facilities. And 20-53.5 is the testing changes for vaccinated and unvaccinated staff. And then before we wanted to move on, I know there's been a lot of talk and there's a lot of push to increase the use of respirators, both as source control or, in lieu of a surgical mask, but also the movement of really away from extended use of N95 respirators to single use of N95 respirators, which is what they're designed to do. But there's a real push to get folks to move in that direction from Cal OSHA. And if you guys don't attend the HSAG webinars on Wednesdays at 3 o'clock, the CDPH ones, last week's recording, and I'm sorry, I don't have a link here. I don't know if it's up quite yet, but generally, if you go to the HSAG website and you do CDPH IP webinars, the webinar from last Wednesday, so that would have been August 12th, had a speaker from Cal OSHA named Eric Berg. And Eric gave a really detailed description about when to use respirators, where it's okay for them to be used as source control, and what is the frequency in which they need to be changed, and what are some workarounds when you're wearing the respirator for use with the folks with the same condition. So let's say you were in you're working in a red zone and you have confirmed cases. Do you have to swap the respirator in between caring from one resident to the next? And they gave detailed descriptions about how limited extended use could be used in those scenarios, provided that the folks have the same issue. In other words, it's a COVID person and a COVID person, then there would be limited circumstances where the staff could wear the respirator for both interactions. But it would have to, it couldn't be, they couldn't go from COVID to a different MDRO or something else that required full precaution. So it's very nuanced. I highly recommend listening to it and listening to it again to make sure that you understand where and when to use the appropriate PPE. The reason why I have that link there is I know folks are still struggling with the cost of PPE and or purchasing enough PPE. The city and Port of Los Angeles purchased a bunch of PPE for use early on in the pandemic. They have not exhausted those supplies. They're still available for purchase. They have 3 different types of N95s that I could see on their inventory list. 2 of them were under $1 a mask in bulk, and 1 of them was slightly over $1 a mask in bulk. Based on what I've seen the cost be in traditional, kind of vendor relationships, they seem to be less expensive. So I will just say, if it was me, I would explore that opportunity if it's going to save me some money. Make sure that the masks that are listed in the inventory are ones that you want for purchase and that you can make sure that you get fitted. But definitely, I think that's an opportunity for you guys, and I don't want you to miss that. And you don't have to be in the city of Los Angeles in order to purchase from them. If you're outside of the city, they said it's okay for folks, within the county to go ahead and sign up. So definitely do that, even if you're not in the city of LA. All right, so we'll talk about some upcoming trainings. Every 2 months on the first Thursday of the month, ReadyNet does what they call a non-acute webinar. I don't have the link to the October 7th webinar, but I assume it will be October 7th. You can always go to the ReadyNet website for information on when the next webinar is, but all the training videos, the video that they, the kind of the training that they do every 2 months for folks, those training videos are recorded. So you don't have to wait for the actual in-person training to view the content. You can click on that link that says training videos and user guide, It has both the training videos that they give to the non-acute providers, as well as a user guide for how to utilize ReadyNet. If you cannot remember, and it does require you to have your login for ReadyNet to be able to view the training videos or the user guide. If you can't remember your login, just email support@ReadyNet, and they can give you your login based on your facility information. And there's a gentleman named Lewis West at ReadyNet. He's really great about being helpful to folks. So if you have questions, you can always address your questions directly to him. Los Angeles County, I mentioned this at the beginning, Los Angeles County Public Health is having a webinar tomorrow, and it's put on by the ACDC program. Dr. Nie sent me some information on what you guys need to be doing right now, even before the webinar, but they're going to go over this in depth on the webinar, and it's an update for vaccination requirements, the testing, visitation, and more. And anybody can register at that link below. Even if you're in Pasadena or Long Beach in those health departments, I think based on what I've seen is the Long Beach and Pasadena will probably mirror the Los Angeles County updates. I don't know that for certain, but I would say if you're in Pasadena or Long Beach, it'd be worth your listen just to pay attention to this, because it's probably going to apply to both of you guys as well. As a reminder, I don't do a whole lot of CAF, kind of promotional things, and I probably should be better about promoting our own stuff, but CAF has an annual conference. We're planning on holding this conference in person in November of this year, and there's a link to the registration page. We haven't finalized the schedule. Well, we've got the schedule and the dates and everything like that, but the agenda for the conference is still being worked on. But it will be an in-person conference. We'd love to see you all attend. It's a short drive from Los Angeles to Palm Springs, and we hope to make it as worthwhile. We're going to do everything we can to make the conference safe, and to that end, we're going to verify vaccination of every attendee to the conference. And for those folks that have medical exemptions, we'll have a process for folks that cannot be vaccinated. Outside of that, we will do a self-attestation of symptom checks for each of the registrants. And our goal is really to provide a safe environment to make sure that nobody that attends our conference becomes exposed and then has risk to bring it back to the facility. This will apply to attendees and all of the vendors as well. And we've got a lot of flack on that, and we understand it, but we do feel this is incredibly important. And even if you felt fairly hesitant at first with the vaccine, we've seen such wonderful and robust performance from the vaccine, even through this current surge of Delta, that we feel really even more empowered to really expect folks to have been vaccinated if they work in long-term care. And for the Really Ready conference, this is a disaster preparedness conference that's set up just for long-term care. We do this usually every other year. Due to the coronavirus pandemic, that kind of got postponed, and now we're in April of 2022. There's some great information about what to expect at the conference in 2022. We haven't finalize the agenda, but there'll be multiple tracks. We'll have information for both ICFs and skilled nursing facilities, and we try to make it as robust as possible, as well as having an exercise during the conference to help you meet some of those regulatory requirements, and you get really hopefully get better at doing the exercise in your own facility. And then, as a reminder, the Great Shakeout is on October 21st, 2021. It's on October 21st every year. The Great Shakeout is a earthquake drill that can be turned into a facility disaster drill or a mock disaster drill very easily within your facility. At thegreatshakeout.org, there's a healthcare committee, and I sit on that healthcare committee, and we designed tools that you can use to turn the Great Shakeout into an exercise in your facility. And so go to that link there if you have questions about how to do that, and definitely sign up to participate in the Great Shakeout. We'd love to see each facility participate in that. All right, let's hop on to the real meaty stuff here. Vaccine and testing requirements for visitors and SNFs. And I put this first because this is in effect now. So you have to make sure that you're doing this now. Dr. Nye from LA County Department of Public Health, the ACDC unit, she's the one that sent me this information and said, this is kind of a basic rundown of the requirements, but you definitely have to make sure this is in place now. So indoor visitation, the most important point, indoor visitation shall be permitted only in accordance with this order. So SNFs and ICFs, and so this includes everybody, guys. Verified visitors are fully vaccinated, and for unvaccinated or incompletely vaccinated visitors, verify a documentation of a negative test. Now, it doesn't say here in this bullet point, but that negative test in the health order can come within the last 72 hours. And so I read that directly from the health order, and that is, you know, I think we would like to have it back within 48 hours, but the health order allows for 72 hours. So what is a list of acceptable proof of vaccination? So there is an acceptable list of what can be considered proof of vaccination. It's in the public health order. I suggest you click on the link, download that if you haven't already. But I'll just cover what those are. So it's the CDC card that you get, the white card with the, the name of the person vaccinated, the type of vaccine, and the date of the last dose or both doses in the 2-dose series, if they have that. They could have a WHO yellow card. I've not seen what that looks like, but I guess the WHO has a yellow card. And both the 3 CDC vaccines or the FDA approved vaccines are on the list. So the Moderna, Pfizer, and Johnson & Johnson. There's also a list of WHO approved vaccines that are okay as well. Within that public health order, you'll have to click on that link to the WHO, and it will list all on the right-hand side of the first page you go to, it lists all of the approved vaccination types over on the right-hand side. It's not easy to read, but you can kind of see where they all are. If you have foreign workers or other people that have come from other countries that are working either through registry or you've hired them on, some of those WHO vaccines are okay and they count towards this order. So it's important that you understand what those are and look at that record. So in the case of where they don't have the vaccine card, they could have a photo of a vaccination record as a separate document, or a photo of a client's vaccination record stored on a phone or electric device, or documentation of COVID-19 vaccination from a healthcare provider, or a digital record that includes a QR code that when scanned by a smart health card reader displays the reader client name, date of birth, vaccine dates, and vaccine type. And so if you know that if you've tried to use that, the state digital record, the state vaccine verification, it comes fairly quickly. You get the text message to open it up. You open up the link, it gives you that QR code. It doesn't take long to, well, I should say it didn't take me long to get my record, but it does come fairly quickly. When you did get that record, you have to take a screenshot of that because that link only lasts for 24 hours. But nonetheless, those are the acceptable verifications. It's not up to you to determine whether these are falsified or accurate. I mean, clearly, if it looks like somebody hand wrote a vaccine card and it's false, you'd say, hey, come back and present me more appropriate documentation. Otherwise, you're going to be subject to some of these other requirements. It's important to make sure that you understand that you can't be the bearer of who's doing things the right way. You just can make sure that the obvious, fraudulent use is kind of ruled out. And in the health order, it goes on to state, in the absence of knowledge to the contrary, a facility may accept documentation presented as valid. So that's really important. Now, for the unvaccinated or partially vaccinated visitors, they're eligible for indoor visits only if they can show documentation of a negative test. And that negative test could have been either through PCR testing or antigen testing. For those of you that don't do testing at your facility, that would mean that they would have to go get their own testing somewhere outside of that in order to be able to meet the intent of this order. Now, visitors who are visiting a patient in critical condition when death may be imminent, and that could apply to a lot of folks in our settings, they're exempt from the vaccination and testing requirements of this order in order for them to visit inside, but they still have to follow all of the other infection prevention and control guides. These conditions do not apply to visitors seeking only outdoor visits that will not require entering the facility. So if you have folks that are, for one reason they can't meet either of these two things, doesn't mean they can't visit. It just means that we're going to have to accommodate those visits outside. And so that is in effect now. We need to operationalize that as quickly as possible. All right, let's get to the next. All right, the healthcare worker vaccine mandate. And I will just mention that the red line changes for AFL, in reference to the last slides. The red line changes to AFL 14.1 for ICFs and 22.9 for skilled nursing facilities has that language in it. So if you compare that red line version that I included in the handouts, you'll see where it differs from the previous AFL, and it incorporates these new changes. So I just wanted to draw that distinction. So obviously this came out on August 5th, but it's a state public health order, and it requires all healthcare workers in the state of California to be vaccinated completely vaccinated by 9/30 of 2021. And so what does that mean? That means that the second dose, if they're doing an mRNA vaccine, has to be completed by 9/30/2021. This is for existing employees or a single dose if they're doing Johnson & Johnson. Now, I've had a lot of questions about, well, what happens if I'm hiring somebody right now? If you're hiring somebody right now and you begin the process to get them vaccinated and you start on their first vaccination series prior to 9/30/2021, and their second dose is not due to be received until after that date comes, CDPH has said that that is going to be okay. And in perpetuity, because we're still trying to hire folks, we're always going to be onboarding new staff. That would be the process. That the staff wouldn't necessarily be required to have been fully vaccinated prior to them starting work, but they will be treated as an unvaccinated staff member, meaning they have to follow all of the things unvaccinated staff will have to follow while they're in the building until they can become fully vaccinated. But they have to be in the process of being vaccinated, or you have to have an exemption based on the categories I'll go over in a second. The term workers is really broadly defined. And when I say broadly defined, I'm going to read kind of an example of how they define a healthcare worker and where those folks are. And so when we say all healthcare workers, it means all healthcare workers in general acute hospitals, skilled nursing facilities, including subacutes, ICFs, acute psych, acute day health centers, PACE programs and PACE centers, ambulatory surgery centers, chemical dependency recovery hospitals, clinics and doctors' offices, congregate living health facilities, dialysis centers, hospice facilities, pediatric day health and respite care facilities, residential substance use treatment, and mental health treatment facilities. There are some that did not make the list. Home health and EMS are two that come right to the top of my head that were not included in the list. And it's yet to be seen if they will have some other kind of requirement that'll be similar to this. Same with assisted living. I don't know how that will be handled, but just assume that this is going to apply to, if you're listening to this call, it's probably going to apply to you. When they talk about workers, it really refers to all paid and unpaid individuals who work in indoor settings where care is provided to patients or patients have access for any purpose. So, there may be some rare circumstances where you have some place in your building that patients or patients / clients / residents / consumers don't have access to under any circumstance. If you had an employee that worked in that space alone, and they never crossed over into space outside of that space, then I think in that rare condition, they may not be included in the requirement to get vaccinated. But I think that they're trying to make it so broad that essentially anybody that works in an indoor space in one of these environments is going to be covered. And so they go on to list, but not limit the list to nurses, CNAs, physicians, technicians, therapists, phlebotomists, pharmacists, students, and trainees, contractual staff not employed by the healthcare facility, and persons not directly involved in patient care, but who could be exposed to infectious agents that can be transmitted in a healthcare setting. Clerical, dietary, environmental services, laundry, security, engineering, facilities management, billing, administrative, and volunteer personnel. And so while it's not a comprehensive list, it's just about everybody, right? So I just want you to think that this is going to apply pretty broadly, and we've got to look at really moving past, who does this apply to? We're just going to assume it applies to most, if not everybody. So if it applies, what are the things I have to do to make sure? Well, obviously we've got to try to, make sure that we can get folks vaccinated first. But when they've identified either, a medical condition that prevents them from getting vaccinated, or they've identified a religious belief that would prevent them from taking a vaccine, those are the two exceptions that are allowed with a signed declination form. The worker would be required to sign that form saying that they're declining based on religious beliefs, or the worker is excused from receiving a vaccine due to a qualifying medical reasons. Now, that qualifying medical reasons are somewhat defined in the health order. So it's important to understand, to be eligible for that exemption, the employer, the employee must provide to the employer a written statement signed by a physician, a nurse practitioner, or other licensed medical professional practicing under the license of a physician, stating that the individual qualifies for the exemption. It's important to note the statement should not describe what the underlying medical condition or disability is, but just indicate that they cannot take the vaccine and indicate the duration of their inability to take the vaccine. So if it's a short-term thing where they go, okay, they can't take it for this period of time due to this medical condition, but at the end of that medical condition, they could take the vaccine. If that's the case, then we want that documented from the medical provider. Or if it's if it's like an allergy to one of the materials used to make the vaccine, then that would be something that's a permanent, kind of restriction from taking it. And that documentation should list that the duration will be permanent. So those are pretty specific things they want folks in order to qualify for the medical reasons. Now, in order to qualify for the religious beliefs, it's not specific as to whether it's a sincerely, quote unquote, sincerely held religious belief, there's no real requirement for them to substantiate their religious belief with anything other than the signed declination form. And so when we are looking at putting together a template, just a really basic declination form based on religious beliefs, and the forms that I've seen companies that have done this and are really, really basic. So don't overthink it. If you want to create your own, while we're creating one, it's really difficult. It's really the date, the name of the facility, the person they hereby attest to, the receiving vaccines is against their religious beliefs, and through the Employment Equal Opportunity Commission that we cannot discriminate based on religious or we have to make religious and disability accommodations for folks when reasonable. So now that we know this kind of religious beliefs is pretty easy to substantiate for individual employees, and you are not going to be held account to whether that person is legitimately subscribing to those beliefs. That is not upon your purview to view that. That is that individual's responsibility. But we will need to document all of this stuff. Every single one of your staff is gonna, that's not taking the vaccine, you're gonna have to have one of these two things signed. If they're not, I'm sad to say, if you can't get one of those two and this person still refuses, you're gonna have to let those folks go, because what's gonna happen is the state says that each one of you is responsible for making sure that the state public health order is followed. And if it's not, you're going to be subject to citation. So that's important to note. Now, we have actions we have to take if they have met one of these two exceptions. If declined, each one of these employees needs to be tested twice a week. I don't know how long that testing is going to occur. But definitely they're going to have to be tested twice a week. And the employee must wear a surgical mask or N95 at all times in the facility. Now, the health order wasn't specific as to could they remove their mask at meal times and break times. I would assume that would be allowed. I don't know that we could really force them to keep their mask on, because they would have to be able to eat, and we have to provide them an indoor space, a break room, and things like that. I would definitely start thinking about maybe having, separate break times for those unvaccinated staff. And let's talk about record keeping for a second here, because this is, the devil's always in the details here, and this is how, this is the state's expectation and the county's expectation of how you will substantiate how you're meeting these requirements. And you're going to need to maintain records of workers' vaccination or exemption status. So all the workers that you previously vaccinated, we know and we assume you have records of that, because you're inputting that information weekly or daily to CDPH and to CDC. Or their exemption status. Need to maintain testing records of unvaccinated staff. And I would almost keep a different spreadsheet of that to make sure that if asked by either LADPH or licensing to provide that information, you need to be able to provide those records to either one of those entities within 24 hours if asked. I bolded out that first letter, you must. Whenever something says must, I get, it sends up red flags, but you must maintain records pursuant to the CDPH guidance for vaccine records. And that's linked, that's a specific document that tells you how to record information and how to keep it. For vaccinated workers, that signed declination form with written healthcare provider statement, where applicable, as described in Section 2 above, and records pursuant to Section 3 above must be maintained. Now, anytime we maintain health records for employees, those are long-term health records. And I don't have the citation, but I do know that anytime we're keeping records on employee health, those need to be maintained for a significant period of time. So whatever you're doing for your record keeping, if you're saying, I'm going to do this handwritten right now, and that's how I'm going to do this now, figure out an electronic method to do this, because you're going to have to store these records. I mean, it could be 30 years. I don't know. It could be a long time. So definitely want to find a way to keep this stuff in electronic format. It's going to make it way easier for you to try to meet this as we go forward. All right. And facilities covered by this order are encouraged to provide on-site vaccinations. Now, not everybody in LA County has signed up to do vaccinations, but maybe 2/3 of the skilled nursing facilities have ability to do on-site vaccinations. And that is great news, because you guys are in so much more of an advantageous position than everybody else in the state of California. So we went through this really difficult time getting signed up to do vaccinations back in December and January, but now you have the ability to do them yourself. Or my hope is you have the wherewithal to be able to do this for yourself. This becomes especially important as we talk about booster shots for the mRNA vaccines. And I know that the state is going to, and Department of Public Health is going to talk about this on the webinar tomorrow. But the booster shots have been approved by the FDA for use. And I think, and this just came out a couple of days ago, but I'm waiting for kind of more concrete information about when we should begin from CDPH. But essentially, it's 8 months after the second dose of the 2-dose series. So we should be coming up on our 8 months now for those of you that started very early at the end of December with your first vaccination clinic. So it's important, not just for, for staff that we've got to get vaccinated, but it's important when we think about we're going to have to start doing booster shots for our residents and staff here pretty soon. So make sure you're concrete and you understand how to order the medication, how to document the shots, all that good stuff. If you have questions on information about how to do vaccine clinics, there's some links on the bottom, as well as links to the science and research on the actual vaccines themselves. If you don't have the ability to do on-site vaccinations, it's recommended that you determine or establish some kind of access to nearby vaccinations. And for folks that are in the intermediate care facilities that are clearly not able to do vaccinations yourself, I would really start reaching out to your health department partners, the ACDC program, and or the closest hospitals in your system, or the health plans that serve your clients. If they're on a health plan, I would reach out to regional centers and ask them if they know of any ability to get vaccination. I know there are a number of community vaccination sites there. There's still some here set up locally where I am, and if that is your only access to vaccination for your staff, at least make them easy for them to access where those appointments are. Provide them time to go do the vaccination on the clock, so they don't, try to make it as easy as possible, because really the proof is in the pudding with these vaccines, guys. We even with breakthrough infections, and we're not seeing tons, but we are seeing some. So it's still, it's way above 90% for vaccine effectiveness in terms of severe symptom development in our residents and in our staff. And those are the two folks we're most concerned with. The general public, maybe it's a different thing, but we have great data as to what happens when people test positive, What happens to those people after they test positive? Are they going to the hospital? Are they dying? You know, things like that. We have great data on that now, and so we know just how incredibly effective the vaccines are, especially in our setting. So really kind of heighten that. If you didn't believe before, just look at the proof now. And yes, there are one-offs that are the 1% or the 2% or the 6% that don't fall in the effective date. But if it's 96 or 94%, we're way ahead of where we were last year. And that's where we need to keep going. And we got to push everybody to get there. So understand that the vaccinations, and when you're talking to your staff that are still on the fence, and especially for the ICF providers where this hasn't been maybe a big push for folks, is try to understand that folks come from different backgrounds, and just because they don't have the same belief in science or faith in science, try to point them to data points like, hey, listen, if you were concerned before, we've got a lot of data. A lot of your colleagues and a lot of your friends and family and community members have all seen the benefits of doing the vaccination. And the only people that are dying, or the vast majority of the people that are dying in the hospitals, are people that have not been vaccinated. And so we want to encourage folks to understand that it really is the best thing for the folks that they care for, as well as themselves and their families. So I truly believe that. And so hopefully you believe that and you can convince your staff of that. There are culturally sensitive things that maybe we need to be more aware of, and have champions within your staff. Find people within your staff that can bring the message and get people over the hump on getting vaccinated. Explain to your staff that if they have symptoms after they get vaccinated, that they are going to have time off of work to be able to deal with those symptoms, because that is really holds some of those people back. And you as an employer have to make sure that they're allowed to do that. Now, I will say there is a law, a governor's order that was passed that said that we had to do that. If you're not aware of that, that is a requirement. But I don't want you to say, hey, I'm required to pay you if you take time off of that. I want you to say, look, as an employer, I want you to take care of you so that you can take care of our folks. In order to do that, if you get sick after you take the vaccine, I want you to take the amount of time that you need to come back to work healthy and ready to go. I think those small things, any little bit we can do, it can push people over the hump. And if those are the things we've got to take, and of course, if you do that, you got to plan for some staff loss on the other side of that for a few days to potentially deal with any adverse effects, because the vaccine is probably not going to kill you, but it may give you a headache. It may have symptoms of COVID or mirror COVID. So a lot of those things, we're going to want them to stay home and take care of themselves anyways. In terms of, we want to make sure that each one of the employees has access to online resources. There's a billion of those out there. The CDC has tons and tons of stuff, CalTCM, CAF, American Healthcare Association. So what you see linked there is the American Healthcare Association resources on COVID-19. This is mainly geared for you as a provider to be able to access some information on kind of talking points, not just about the COVID-19 vaccine, but also the science behind COVID vaccine. A lot of great stuff. Now, I will say that some of the resources are free, and some of them require you to be a CAF member. And if you're a CAF member, you're automatically a member of the American Healthcare Association. So, but there's tons of free resources there for those of you that are not CAF members, and that's okay. I'm not here to change your mind about anything. So, all right, now let's hop to the next slide, and maybe we can get to some questions today. I know that was a lot to cover, really, really dense stuff. I'll try to get to as many questions as we can. Let me open up the question and answer box. All right. Oh, somebody had a question. What is a DRC? That stands for the Disaster Resource Center, and there are 13 of those DRCs in Southern California. And Now, not all of them are, geared towards dealing with skilled nursing facilities. There's one that is a pediatric subacute facility. Okay, let's see here. But for the most part, the DRCs are where all different healthcare entities, not just skilled nursing facilities, but clinics, hospice, dialysis, all of those folks traditionally are assigned to a disaster resource center that's closest geographically to them. So if you've not been to a DRC meeting before, or you're unfamiliar with what they are, in the handout section, if you download the DRC contact list, it has the hospital where the DRC is located, the contacts for that DRC, their email address and phone number. I would suggest reaching out to the DRC and just look at where the hospitals are, and you'll be able to see the one that's most closest to you. I would reach out to them and say, hey, listen, I would like to get plugged into the DRC meetings. Can you put me on the list, sir, so I can get a copy of the meeting schedule? And then while it's virtual, you can go to the meetings, you can listen into the content. Now, generally, the content is geared more towards acute care hospitals, but there's a lot of crossover information that's given by the county and by the hospitals. But beyond the information that's given, I can't recommend this enough. It's a great place to meet people that you will have crossover with during a natural disaster, or you could potentially have crossover with. And, there's no harm in having more tools in your tool bag. And I want you to think about our partners at the acute care hospitals as specialty tools in your tool bag. And building those relationships with those folks allows you to access those tools. And maybe the tool is knowledge about how to do infection prevention appropriately, or how to set up negative pressure isolation, or it could be a million different other things, but there's lots of good stuff contained, and lots of expertise contained within the folks that attend those meetings. If you have questions about how to use a ham radio, or what happens if the cell phone service and hard lines go down, well, there's those DRC folks. They have ham radio operators, and there's ham radio operators at the county, and they talk about some of that stuff at those DRC meetings. So it's beyond that. They do talk about CMS requirements and how to meet some of those requirements, but I really encourage you guys to attend, especially while they're virtual. We want as many skilled nursing facilities to participate as we can. All right, the next question. Our yellow zone residents are in shared room. What's the best way to go about in-person visits? And that's a great question, Margarita. I think we'll anticipate that LA will expand on that. Dr. Nye and Dr. Raj will probably expand on that in the webinar. But based on what I can see is, if they're doing in-person visits, they're going to have to be fully vaccinated or tested negative prior to that. Even when they come in, they're going to have to wear masks and everything like that. So I think they're going to allow the in-person in-room visits with the same recommendation that the roommate not be in there. And then if the roommate is in there, that there be 6 feet of separation. But because the visitor now is going to have to show documentation of vaccine or that testing, I think there's a little comfort in now you kind of know what that person's status is when they come in to visit. So I think they're going to allow the in-person in-room visits, provided they meet those requirements. I don't know, what she's going to say about, whether the other resident can remain in that room. And I think we'll have to wait until tomorrow to find out where that lands. Do government entities follow under the DRC's jurisdiction? Well, the DRCs are really there for you, and they're a grant-funded program through LA County EMS. And so if you have a DRC that's closest to you, and I'm assuming you're a veterans home or something like that, the DRC that's closest to you would be responsible for kind of managing those resources in the event of a disaster. So while the DRC doesn't necessarily have a jurisdiction, it does have a responsibility to provide those services to everybody in its catchment area. And especially if you're a veterans home, you guys have a tremendous amount of experience to bring to bear, a knowledge that is traditionally not found in other skilled nursing facilities. I highly recommend having your safety team or folks, your safety coordinator, if you have one, on-site or safety officer, attend those DRC meetings that is closest to you. They can always gather good information, and they have great information to share to help kind of inform the way hospitals think about what skilled nursing facilities do. Could not download the MS Word attachments. Can you send them to us in another way? Tell you what, can you do me a favor? I won't announce your email address, but can you put your email address in the question and answer box, and I will, I'll convert them to PDFs and I'll send them to you via PDF. How's that? And so just send me your email address and I will get them to you in a PDF form. Oh, perfect. Okay. Next question. We have 2 nursing schools that intern at our facility. Can we require them to be vaccinated or show proof of a negative test before entering the building and treat them as a visitor? So yes, you're going to treat them as a visitor, but after September 30th, anybody from a nursing school is going to have to be fully vaccinated, or they have to show an exemption based on either the medical condition or the religious beliefs. So right now, vaccinated, show proof of a negative test with 72 hours and treat them as a visitor. I think that is appropriate. And then obviously, we're going to make sure that they're wearing a face mask, a surgical mask, or an N95 respirator the entire time they're in the building. Just remember that on September 30th, once that date drops, then you're going to have to treat them as an employee. How do we sign up with ReadyNet as a government entity? Oh yeah, I guess, and I've not found a way around that. Yes, everybody has to sign up. ReadyNet is a private company owned by the Hospital Association. And even I have to sign their contract to do that. And when in any other in other way we would not do that. Unfortunately, I think that's just the way ReadyNet does business. The LA County EMS, which contracts with ReadyNet, also has to sign their contract. So I'm assuming there's no other way around that, but I can definitely ask. So. All right, we've got to the end of our presentation. Just as a reminder, if you want to let folks know, or if you have ever folks within your organization that need to review some of this material, these are recorded. We'll put them up on YouTube, and then you can, kind of breeze through them to get to the most important points. When we put them on YouTube, we can't do the handouts. So if you need the handouts, email me, and then I have the email address. And I'm going to convert these to PDF and send them. If you need the same thing, just send me an email and I'll get you guys the PDF version. Okay, our next meeting is set and scheduled. You can always register on the CAF website. I hope to see you guys at the CAF in-person conference, but if not, I hope you have a wonderful rest of your week, and we will talk to you soon. Thanks a bunch, and thanks for tuning in. Have a good one.